Lower extremity venous disease is very common in the United States, affecting 30 to 40% of women and 15 to 20% of men. As one ages, veins lose their elasticity, causing them to stretch out. When this occurs, blood in the legs, which should be moving toward the heart, starts to flow backwards. The increased venous pressure that develops causes blood to pool in the legs. While varicose veins represent a medical condition which is chronic, progressive, and usually inherited, there are minimally invasive techniques available for their effective treatment. To learn more about this innovative state-of-the-art varicose vein treatment, we went to HogueVein Institute.
Our vein treatment strategy consists of what we like to call a continuum of care approach. This involves initially treating the abnormal veins with the endovenous laser, but then that's followed with sclerotherapy. Sclerotherapy involves injecting the abnormal branch veins with a chemical that also closes them off. We feel very confident that we can improve not only the appearance of your legs, but also how they feel, which will translate into better quality of life issues.
With vein clinics in Maple Grove, Mankato, Fargo, and Grand Forks, the HogueVein Institute has distinguished itself as a Midwest vein care leader. On its medical staff are 3 of the 8 physicians currently practicing in Minnesota who are board certified with the American Board of Phlebology, recognized by the AMA as vein specialists, and certified by the American Registry for Diagnostic Medical Sonography as registered vascular technologists.
I came into HogueVein Institute because I had leg clots, and they came in and they did laser surgery on me, and I had to wear compressions. And right away afterwards, I was on a treadmill, which amazed me because to be up walking was just really cool for me. And no pain. It was just, I went back to work. It was very non-invasive, and I was very happy with it.
Patients start their care at HogueVein Institute with a lower extremity venous insufficiency assessment, which checks for venous reflux and provides a clear mapping of the veins. This allows for an accurate diagnosis, so an appropriate, customized treatment plan can be made specific for each patient's vein condition. The reassuring news is that varicose veins can be effectively treated with minimal discomfort using an FDA-cleared revolutionary procedure called endovenous laser ablation, or EVLA. During this procedure, an intravenous line is placed in the targeted varicose vein. Laser energy is then delivered through an optical fiber along the vein's course to thermally ablate the vein, thereby shrinking and collapsing the vein. There is no need for general anesthesia or hospitalization during an EVLA procedure, and unlike surgical vein stripping, the recovery period is measured in minutes, not weeks to months.
At HogueVein Institute, we are committed to state-of-the-art vein care. We use the Cyton Pro V laser, a 1319 nanometer Nd:YAG laser, which represents a significant advancement in the industry. For our patients, this means significantly less pain and bruising. Because ablation temperatures reached are hundreds of degrees less than diode laser systems, we are able to perform endovenous laser ablation without causing burns to the skin and without causing visible darkening of the skin from burnt blood. We feel so strongly about this that we have placed a Cyton Pro V laser in each of our 4 clinics.
When it comes to experience, HogueVein Institute physicians have performed over 6,000 endovenous laser ablation procedures, the most in Minnesota.
I was referred to Dr. Hogue. I had previously had vascular surgery, and it was successful for about a year, but the follow-up was not what it should have been. Dr. Hogue followed up with a sclerotherapy. Today, almost a year later now, all my swelling is gone, my varicosities are gone. It's one of the best investments I feel I've made.
Roughly 20% of the patients that are seen here at the HogueVein Institute have had prior surgical stripping. Most of these patients seek our expertise because of ongoing symptoms and discomfort. Essentially all of them can be adequately treated with the endovenous laser technique that we specialize in. HogueVein Institute offers not only the most experienced vein specialists, but also the most up-to-date and comprehensive vein care available.
HogueVein Institute physicians are also involved with clinical research and have published an original article in the Journal of Phlebology.
I came to HogueVein Clinic because I was experiencing achiness in both of my legs. Dr. Hogue did an evaluation, and after that we scheduled the EVLA procedure to be done on me. The procedure was painless. I was up and moving immediately that night and continue to this day to have no pain in my legs, and I'm very glad I had the procedure done.